10 exercises that destroy your elbows the most after 40 years old. Many try to ignore it, but the fact is that after 40, your body makes it clear that power without control comes at a steep price. And among all the joints, the elbow is one of the most treacherous. It's involved in practically everything: pushing, pulling, lifting, and holding. It's precisely this constant participation that makes it so vulnerable. Injuries don't appear suddenly. They form in silence, micro-trauma after micro-trauma, until one day the pain shows up without warning and forces you to stop. When it arrives, it doesn't just limit your training, it makes simple tasks uncomfortable, like holding the steering wheel or even opening a bottle. That's why I always tell my students that after 40, the goal isn't to prove strength, but to preserve performance and longevity. You need to train smarter, respecting your body's mechanics and the natural wear of age. Today, you'll see 10 exercises that destroy the elbows of men who have passed 40 the most, and a less harmful substitute for each one of them. Before we begin, please tell us through the comments your name and the city where you're watching our content from. We'd love to know. Exercise number 10, skull crushers with barbell. This movement places the elbow under brutal eccentric leverage, especially when the bar is lowered to the forehead or behind the head. The triceps tendon inserts directly into the olecranon, which is the bony tip of the elbow, and suffers intense stretching throughout the entire descent phase. With heavy loads and high weekly frequency, this repetitive stress generates accumulative microlesions. After 40 years old, there's a natural reduction in tendon elasticity and the ability to dissipate impact forces, which amplifies these microlesions and delays recovery. What many people don't realize is that the problem doesn't always appear during training. The pain emerges hours later, sometimes the next day, as triceps tendinopathy or olecranon bursitis. The most common mistake is locking out the elbow at full extension with excessive force, creating an unnecessary tension peak. Another error is using weight that doesn't allow controlling the descent, transforming the exercise into free fall followed by explosive effort. For those who have passed 40, this pattern is a recipe for chronic inflammation. The elbow's anatomy wasn't designed to withstand this type of repeated overload without consequences. The smartest substitute is triceps on the cable with rope, maintaining neutral grip and elbows fixed to the body. This adjustment drastically reduces joint torque, maintains full triceps activation, and allows controlling the load throughout the entire range of motion, without placing the tendon in a vulnerable position. Exercise number 9, barbell bench press. The bench press transfers much of the force generated by the chest and deltoids directly to the elbow in extension under heavy load. When the grip is too narrow or the wrist becomes misaligned, there's excessive forearm rotation that unevenly tensions the triceps tendon. Additionally, people with shoulder stiffness, something extremely common after 40, tend to compensate by pushing with their elbows too wide, which increases joint shearing. This repeated shearing wears down the cartilage and joint capsule, structures that already tolerate less compression with advancing age. The problem is aggravated when there's an attempt to progress in load without correcting technique. The elbow joint begins to absorb forces that should be distributed among chest, shoulders, and triceps. Over time, inflammation emerges that can evolve into tendinitis or even chronic pain that prevents basic pushing movements. The main errors to avoid are lowering the bar too quickly without eccentric control, using excessively narrow grip that forces internal rotation of the forearm, and not retracting the scapulae correctly before initiating the movement. The safest substitute is the dumbbell bench press, which allows natural rotation of the forearms throughout the entire movement and individual adjustment of range of motion according to each person's mobility, reducing torque on the elbows and preserving muscle stimulus in the chest and triceps. Exercise number 8, military press. This vertical movement presses the triceps and elbow in maximum extension, requiring continuous stabilization against gravity. The problem arises when using too narrow a grip or excessive range of motion below the chin line. This position places the elbow at a critical shearing angle, forcing the collateral ligaments that stabilize the joint. Shoulder stiffness, a typical characteristic after 40 years old, aggravates the misalignment and transfers additional tension to the elbow as a form of compensation. What happens anatomically is that when trying to push a vertical load with limited shoulder mobility, the body seeks stability wherever it can find it, and the elbows end up paying the price. Repeated compression in this vulnerable position causes tendon inflammation and can lead to persistent pain that affects even daily activities. The most common errors include using load beyond control capacity, not adequately warming up the shoulder girdle before the exercise, and forcing range of motion that the shoulder doesn't naturally allow. Another mistake is believing that the lower you bring the bar down, the better the stimulus will be, when in reality, this only increases risk without proportional benefit. The ideal substitute is seated dumbbell press, starting at ear height, with neutral grip where the palms face each other. This variation maintains complete stimulus in shoulders and triceps, but offers joint freedom and better distributes forces, generating much less stress on the elbow. Exercise number 7, triceps pushdown with straight bar. The risk of this exercise comes from the fixed pronated grip, which prevents natural forearm rotation and forces the elbow extensor tendons to work at a mechanical disadvantage. With high loads, the repetitive friction on these structures causes lateral epicondylitis, commonly known as tennis elbow. The problem is that many people progressively increase the load without realizing they're generating a dysfunctional movement pattern. The common mistake is pushing with the torso or opening the elbows too much during execution, compensations that arise when the load is beyond the isolated control capacity of the triceps. After 40, repetitive overload on tendons with already reduced blood irrigation accelerates degenerative processes and microlesions that accumulate silently. The elbow's anatomy functions better when there's freedom for small natural rotations of the forearm, something the straight bar simply doesn't allow. Over time, pain appears on the lateral part of the elbow that worsens when gripping objects or performing wrist extension movements. This pain can become chronic if the harmful pattern isn't corrected. The safest substitute is triceps with rope on the cable, which allows slight final wrist rotation as the movement progresses. This variation distributes the load among all 3 triceps heads more evenly, reduces the focal point of joint stress, and maintains high muscle activation without compromising tendon integrity. Before we continue, don't forget to subscribe to the channel. Having constant access to science-based information is what will make you progress with health in the long term in the world of bodybuilding. Exercise number 6, bent over row with supinated grip. Although this exercise strongly recruits the biceps and lats, the supinated grip imposes internal twisting on the forearm and generates intense traction on the distal biceps tendon, a particularly vulnerable point in mature men. The body weight leaning forward also transfers part of the load to the elbow during the movement stabilization phase. With frequent repetition, especially with progressive loads, tendinitis or even microlesion of the distal biceps can emerge, a sneaky injury that's often only identified when already advanced. What makes this exercise treacherous is that the person feels they're working the back and arms well, without perceiving the accumulative stress on the tendon insertion. After 40, tendons lose part of their regeneration capacity due to reduced type 1 collagen and lower local vascularization. The main errors include using excessive load that forces using body momentum, not keeping the core stabilized during the pull, and performing the movement with uncontrolled speed. Another mistake is believing that supinated grip is always superior for biceps recruitment, when in reality, the joint risk often exceeds the marginal benefit. The safest substitute is the neutral grip row, whether on a specific machine or with dumbbells. The neutral position completely eliminates forearm twisting, maintains focus on the lat, and protects the elbow tendons from excessive traction, allowing training with more volume and frequency without accumulating structural damage. Exercise number 5, straight barbell curl. The straight bar forces the forearm to remain in fixed supination throughout the entire movement, reducing the natural rotation between ulna and radius that would happen under ideal physiological conditions. This excessively tensions the flexors and pronators of the forearm, predisposing to medial epicondylitis, the famous pain on the inner part of the elbow. Heavy loads, quick movements, or the use of body momentum to complete repetitions drastically increase tendon tension. After 40 years old, These structures already present lower blood irrigation and regenerate much more slowly, making any chronic overload a serious problem. What many people don't understand is that the straight barbell curl forces an anatomical position that the elbow wasn't designed to sustain underload for long periods. The radio-ulnar joint needs mobility to function without excessive friction, and the straight bar eliminates this possibility. The most common errors are initiating the movement with hip momentum, not keeping elbows fixed to the side of the body, and using weight that doesn't allow controlling the eccentric phase. Another mistake is believing that the more weight, the better the result will be, when in reality, this only increases the probability of injury without necessarily generating more hypertrophy. The ideal substitute is the curl with EZ bar, or with alternating dumbbells, using semi-supinated grip. These variations maintain complete stimulus on the biceps, but respect the natural anatomical axis of the elbow and allow small adjustments in forearm rotation as needed. Exercise number 4, parallel bar dips. This is a highly compressive movement where the elbows are in deep flexion, sustaining the complete body weight. The transition between the descent and ascent phases requires explosive, simultaneous contraction of the triceps and chest, which dramatically elevates the shearing force on the joint. In people over 40, the risk of acute triceps tendon inflammation or even partial rupture is significantly elevated, especially if there's an attempt to progress by adding external load before completely mastering the pattern with body weight. The problem is that many people underestimate this exercise's intensity. They think that because it's a body weight movement, it's automatically safe, but in reality, the relative load can be extremely high, depending on the angle and range of motion used. The elbow joint is subjected to compression, shearing, and traction forces simultaneously, a challenging biomechanical scenario even for young and healthy joints. The main errors are descending beyond the safe range of motion, where the shoulder passes the elbow line, performing the movement with excessive speed, and not warming up adequately before executing. Another serious mistake is trying to add extra weight before being able to perform at least 15 controlled repetitions with just the body. The smartest substitute is bench dips or the assisted dip machine, where the body remains more stable and it's possible to precisely control range of motion and load, maintaining muscle focus on the triceps without overloading the elbow joint. Exercise number 3, diamond push-ups. The narrow grip characteristic of this exercise forces the elbows inward and significantly increases the extension angle at the end of the movement. This configuration concentrates torque on the medial region of the joint, overloading the collateral ligaments and triceps tendon asymmetrically. Even without external load, body weight can be sufficient to cause pain and inflammation after 40, especially if the exercise is performed with high weekly frequency. What makes this movement problematic is the forced position of wrists and forearms. By placing the hands very close together forming a diamond, you eliminate the possibility of natural adjustments in forearm rotation, creating a rigid pattern that increases joint stress. Most people also make the mistake of not keeping their elbows close to the body during execution, which further aggravates the situation by adding an unwanted rotational component. Other errors include descending too quickly without eccentric control, not keeping the core activated to avoid compensations, and performing the exercise to complete fatigue when technique is already compromised. The safest substitute is the push-up with neutral grip, using parallel bars or resting hands on dumbbells that allow this position. The neutral alignment of the wrists drastically reduces rotational torque on the elbow and preserves the excellent triceps and inner chest stimulus that push-ups provide, but in a much more sustainable way long-term. Exercise number 2, kettlebell swings. Despite appearing to be a safe movement focused on lower limbs and core, the swing involves rapid acceleration and deceleration, with elbows almost fully extended, requiring fine and constant control of the triceps and forearm extensors. Small angle deviations during the deceleration phase generate repeated traction on the distal biceps tendon and simultaneous joint compression. After 40 years old, connective tissue presents greater stiffness and lower capacity to absorb ballistic impacts, making this type of movement particularly risky. The problem is that people associate the kettlebell swing mainly with glute and hamstring work, completely neglecting the stabilizing role of the elbows. During each repetition, especially when the load is heavier or speed increases, the elbows need to actively stabilize the weight in rapid movement. This dynamic stabilization under load at speed creates microtraumas that accumulate silently. The main errors include using a kettlebell too heavy for control capacity, performing the movement with excessively bent arms instead of keeping them more extended, and not respecting the technique of receiving the weight with the hips instead of with the arms. The safest substitute is the hip thrust, or Romanian deadlift, with moderate load, exercises that intensely activate the same target muscles, glutes, and hamstrings, without requiring dynamic and ballistic stabilization of the elbows. Exercise number 1. Pull-ups with supinated grip. The supinated grip forces the elbow in deep flexion under high vertical traction, especially on the distal biceps tendon, which inserts near the elbow. This is one of the exercises most associated with partial or complete biceps rupture in mature men, a serious injury that often requires surgical intervention. The most common error is trying to perform full range of motion using momentum or body swing. Movements that generate force peaks far beyond the tendon's absorption capacity. After 40, the regenerative capacity of tendons is reduced and local vascularization is lower, making any acute overload potentially devastating. What many people don't realize is that even if they can perform the movement without immediate pain, the accumulative damage is happening. Each repetition under intense traction with supinated grip generates micro-lesions that add up over weeks and months. Another mistake is believing that if you've always trained this way without problems, you can continue indefinitely. The reality is that tissues age, and what was tolerable at 30 can be harmful at 45. The main errors include not performing specific warm-up before the exercise, using excessive range of motion forcing the elbow beyond comfortable, and performing repetitions to concentric failure. The smartest substitute is pull-ups with neutral grip, where the palms face each other, or using resistance bands for assistance to reduce the load. This variation maintains the same excellent recruitment of lats and biceps, but with natural forearm alignment and much less torque on the elbow joint. If you enjoyed this and want to also discover the exercises that most destroy, also silently, your knees and spine, we left a video appearing right now on the screen showing each one of them better. Be sure to check it out. Thank you for watching until here, and may God bless you, my friend.